So, good day, ma'am. I am Mapul K. M. Muhammad, a student nurse from Davao Doctors College. And for today's third demonstration, I am going to demonstrate the cardiopulmonary resuscitation or CPR for both infant and child. So, before we start with the procedure, let me explain what is CPR. So, CPR is a emergency life-saving procedure performed when the patient's heart stops breathing or the patient stops breathing or collapse. So, let's start first with an infant CPR. Let's assume that the scenario was a mother approached you inside the hospital and said first she thinks that her baby is not breathing. At this time, you are going to get the baby from her and place the baby in a firm or flat surface above ground such as a table or the bed that flat, okay? So, then check for the response and for no breathing or only gasping for at least 5, but no more than 10 seconds. Baby, help, somebody help. Hear that? Asking for help and check for the pulse and breathing. Open the airway of the infant. Check for the pulse and breathing. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So, the second rescuer arrives and asks, "What's wrong with the baby?" No pulse and no breathing. Activate the emergency response system and bring me an AED. After sending someone to activate the emergency response system, you will start giving the CPR to the baby. When giving a CPR to an infant, find the correct position for compression by using 2 fingers of the lower half of the breastbone just below the nipples, or you can encircle the infant's chest with both hands and spreading fingers around the thorax, and place both thumbs together over the lower half of sternum. The adequate rate for this is at least 100 compressions per minute, in which will be given in 30 chest compression for each set for 10 seconds or less, with a depth at least 1/3 or approximately 1.5 inches or 4 centimeters of each compression. Also allow for complete chest recoil so that blood can refill the heart's chambers between compressions. Then after that, giving 30 compressions, give 2 breaths with the use of pocket mask with at least 1 second gap before giving the second breath. Starting the CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2,
At this
3,
time,
4,
the
5,
second
6,
rescuer
7,
arrives
8,
with an
9, 10.
AED
1,
and a bag
2,
mask
3,
device.
4, 5,
Continue
6,
chest
7, 8,
compression
9,
while
20.
the second
1, 2,
rescuer
3, 4,
applies the
5,
patch
6,
on the
7,
lower
8,
left chest
9, 30.
below the armpit.
We touch the patient. Shock advised. Charging. Stand clear.
Everybody clear?
Clear. Press flashing shock button. Shock 1 delivered. It is safe to touch the patient. Begin CPR now.
After switching roles, continue to resume the CPR while the second rescuer gives chest compressions. The first rescuer will start to put the bag mask device, then give 2 breaths after 30 chest compression. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Now that I am done to demonstrate the CPR for the infant, let's proceed to the CPR for the child. Just like with an infant, we are going to open airway and check for the child breathing for no more than 10 seconds using the look, listen, and the feel method. So you do that by putting your cheek above their mouth and nose so that you can feel the breath on your cheek. So you look down the body and you feel the movements of the chest, and you look, you listen, and you feel for up to 10 seconds. And you should have at least 2 breaths in that time, just like that. So if the child is not breathing, give 2 rescue breath for the one-on-one, 1 to 1.5 seconds for each breath. After then, check the child pulse, and if there is no sign of life, proceed to the cardiopulmonary resuscitation or the CPR. When giving CPR to a child, unlike the infant, we are going to put one hand in correct position, which is in the lower half of the sternum for the chest compression. Then give 30 chest compressions in 1 to 1.5 inch deep of a rate. So of 100 compressions per minute. So continue 5 cycles of chest compressions and 2 rescue breaths and allow for complete chest recoil. Let's start the CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Give 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Give 2 rescue breaths. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Give 2 rescue breaths. After a minute of CPR, you will then pause and check the child for the carotid pulse and breathing. So let's check the pulse of the baby. So, if in a case that the child is still not exhibit circulation, that's the time to use an AED for them. So, in placing the AED patches, the one will be at the center of the chest, while the other one is at the back, just below the armpit. So, but since in our scenario, the child was able to cope up with his circulation after a minute of CPR, which means there is no need, or we don't need for an AED for the child. Next is to put the patient into recovery position, which is a side-lying type of position. Let the patient stay at this position until the help arrives if this happens outside an hospital. So now let's position the patient into a recovery position. So after positioning the client, document the type when the procedure started and the time of the recovery. This is to serve as an evidence that the procedure was done, and in case that the patient's guardian will ask for it. So if you'll have a document to support your statement and the action. So now that I am done, document all the information. So that's all for the child CPR. That's it for the child cardiopulmonary resuscitation. Again, I am Mapol K. M. Muhammad from BSM 2 12D of Group 35. Thank you!